If you're considering a facelift, you probably have a clear idea how you want to look: refreshed, lifted, and natural, without looking like a different person. But the part that makes most people nervous is what they have to go through before they get to their final result. The swelling, the bruising, the tightness, the bandages, and the moment where you look in a mirror and wonder, did I make a mistake? I'm Dr. Yash Avashia, a board-certified plastic surgeon specializing in rhinoplasty and facial surgery. And in this video, I'm going to walk you through the real facelift recovery timeline, from the first 48 hours to the months where everything finally settles. The first timeline that's very important is those first 2 days, the 48-hour window, leading up right after your surgery. Surgery is typically somewhere between 4 to 6 hours. And at the end of surgery, you're gonna have a big head wrap on. I call it the Q-tip dressing because that's really what it looks like. Your whole head is wrapped up in white cotton and you can see your face. Most patients have 2 drains as well. That relieves any of the fluid that you may develop after surgery. Now, in those first 48 hours, one of the big goals that we have is to monitor your blood pressure, and that will reduce the risk of bleeding, which is something we don't want in those first 48 hours. Something else we always really work on is making sure you're comfortable, making sure that there's no real pain. In most cases, there's not. Making sure your anxiety is well controlled as well. Sometimes having that head wrap can be a little claustrophobic, but all that gets better because at the end of the first 24 hours, that head wrap is removed, the drains are taken out, your hair is washed, and you're kind of cleaned up. And so it gets a lot better after the first day leading into the second day. One of the other things you want to really make sure is that you're comfortable eating food, drinking liquids, tolerating your medications that I'm prescribing to you after surgery. All these things happen in those first 2 days. Another real critical part of those first 2 days is getting adequate support and care. And so for me, all my patients spend at least one night in a recovery facility where we have a 24-hour nurse monitoring you, taking care of you, and addressing all these things for you as they happen. Now, moving on to the next period is going to be your day 3 to day 7, that first week. This is when you're back at home. You're getting into your normal routine, you're getting comfortable, but these are a couple things that you should be careful for. Keep your activity very low. Try not to do a lot of work around the house. Don't bend over. I oftentimes tell my patients not to turn your head from side to side or even bend down very much. You kind of want to keep it in a neutral position. It's normal to feel tight in your jaw. A lot of that is from all the internal work that we've done to really support and improve that neck contour that you're going to have. In this first week, a couple things are going to happen. First thing is you're going to start to swell more. Your peak swelling kind of happens around day 5 to 7. That's very normal. Bruising may start to develop. Those first few days, you may not notice any bruising, and that's awesome. You may notice a little bit more bruising in that first week, and it typically peaks by the end of that first week. Something else that's also going to happen in that first week is that we're going to start some of your postoperative care plan, which is going to include lymphatic facial massages to help counteract that new swelling that you're developing. We're also going to recommend hyperbaric oxygen treatments. This is very powerful. It helps reduce your bruising, reduce your swelling, and actually speeds up your healing recovery time as well. And that's going to lead us into the next phase, which is really your week 2. And this is the timeline where most patients start feeling a little frustrated, right? Stitches are out, you're still a little bruised, sometimes swollen as well for sure. And you're looking yourself in the mirror and you're feeling just maybe a little uncomfortable. You're not sure whether you did the right thing or not. And you have to tell yourself, this is very normal. Feeling this way, looking this way after such a big face surgery, very normal, and you just have to kind of trust the process and allow that time to pass. What you don't want to do is, as you start feeling more comfortable, you don't want to get more active. You don't want to be bending or lifting heavy objects. I tell patients you can do a light cardio, which means a brisk walk outside. If it's hot, in Dallas it's always hot, so wearing a UV visor really makes a big difference for you. But the idea is maintain a very even kill activity, no exertion, allowing that time to really pass. Most patients at this point are still continuing their lymphatic facial massages. Most patients are also continuing now with a skincare plan that I give them and scar care plan that I also provide them to help optimize how their incisions heal. This leads up to our next point in time, which is week 3. This is the in-between period where some of that initial swelling and bruising is now starting to subside, and you're starting to see some of the improvements and the results itself. Now, believe it or not, you're still very swollen. You'll still have some asymmetry. You'll still feel tight. You'll still feel very numb as well. All very normal things to realize during this period in time. Most patients start socializing in that third week. They feel comfortable going out for lunch or dinner. Some patients go back to work as well. They're client facing again. And that is something you can truly expect for yourself. Now, again, still a long way to go with your recovery, but that week 3 is a great transition point where you start to appreciate the early result. Weeks 4 to 6 is where patients really come back to my office. Typically, I have a 1-month follow-up, which is right in the middle, and they start feeling a lot more comfortable. They realize that the first month has gone away, and they start seeing some of the improvements. Still swollen, still tight, still numb as well, but now returning back to normal activity. And so from 4 to 6 weeks, patients start going back into their normal routine. I tell patients it's okay to go back to a workout routine slowly, increase very gradually. Patients start returning to work at full time. Things start getting very normal. They're going about their normal life. And I think that's very important. Still, they can see the improvements. Sometimes the early result is amazing and they're really enjoying that swelling. In some cases, some patients don't like that swelling, and that also is very normal. It's specific for patient to patient and what their facial anatomy looks like. But at that 4 to 6 period, that's when things start to normalize a little bit more. Now let's fast forward to months 3 to 6. And this is kind of a real magical moment for a lot of patients. When patients come back at their 3-month follow-up and their 6-month follow-up, they're now saying, wow, I really see the difference. I'm very happy I did that. When you go back to 1 month or even that first month itself, patients are typically scared. They're a little unsure. They don't normally recognize who they see. But at 3 and 6 months, things start to really normalize for them. That early swelling has all subsided. The tissues start to soften and settle as well. The scar starts to mature, but believe it or not, there's still recovery to happen. Scar maturation doesn't really happen until the end of the full first year. And a lot of the small swelling really improves over that first year, believe it or not. But by 3 months, most patients are saying, absolutely love the result, and they're just waiting time till all that final healing really happens. Most patients should be full activity by this point. They can be full-time at work, they can go back to the gym and do their full workouts. They can do everything around the house as well. Recovery will happen simultaneously with their day-to-day life activities. And now that we've gone over your timeline in kind of a big picture, let's talk about the things that no one really talks about. It's the emotions, it's the safety and recovery habits. So let's talk a little about the emotional recovery here. So after a big facelift surgery, when you look in the mirror, you may not recognize yourself, and that's very normal. And the transition to a point where you start to recognize yourself and feel very comfortable with what you see is different for everybody. For some people, it happens within that first month, but for most, it actually happens at 3 months or even 6 months. Once you get to that point, you start feeling a lot more comfortable and confident with what you did, the facelift surgery. It's very normal in that period of time to look in the mirror and not feel comfortable, to feel a little unsure of whether or not you made the right decision or not. And I always tell my patients, it's that point in time where you call my office, talk to my team, or even talk to me, come in for a follow-up. Because I think hearing the reassurance that this is very normal, that you are going to get better with time is super important. You don't want to overanalyze yourself at that point in time, and you kind of want to trust the process realistically. So the other thing that you may not always hear about in the recovery period is what are some of the safety parameters to look at? What are some things you should look out for in your recovery period? First things first, as I tell patients, always look for any acute swelling. One side got larger all of a sudden than the other side. One side is all of a sudden more bruised than another side. It's typically more of a concern in the first few days, in the first week, but it's still something to keep an eye out for in that first month, believe it or not. If you notice these things, call me. Call the surgeon, call your team. I think it's very important to let them know what's going on. Something else to look out for is any new sensation, redness, white bumps around the incisions, around your cheeks, sometimes in your neck. That can indicate an infection. Now, we all have a certain type of bacteria that lives inside our noses and our ears, and it's very close to some of the incisions that we have for your facelift. And so having an infection can happen. The best way to treat that is proactively. Start on an antibiotic routine. That's the first thing I do for all my patients. I start them on a topical routine as well. So the combination of both really counteracts that infection and treats it pretty proactively. But that's something else to really keep a lookout for. It's just your generalized swelling and bruising, making sure all that's subsiding appropriately to the timeline that I just mentioned. If you notice yourself, you're still really bruised at 1 month, that's not necessarily within the normal range of recovery. And so there are some things that we can do to help expedite that process with laser treatments, lymphatic massage treatments, and even hyperbaric oxygen treatments. So these are some things, safety parameters to keep a lookout for as you recover. Now, I know some of this can be a little scary to hear, but here are a couple ways to actually proactively manage your results and kind of prevent some of these things from happening. So first things first is rest. Don't be too active in the first week, the first month. Really give yourself time to recover. Get adequate sleep, very important. On the note of sleep, I like recommending my patients to sleep with a few pillows behind their head. Elevating their head will help reduce some of that swelling as well. So sleep is really important. Eating a balanced diet. So what that really means is a high protein, low salt, moderate to low sugar diet as well. Salt and sugar will actually increase how much you swell. And so you want to avoid that. And so processed foods, fast foods, definitely not the best thing to have in your first month after surgery. Now, moving forward, I tell patients really clean your incisions in that first week to first month. So early on, you may notice a little dried blood, a little crust along your incisions. You want to clean that with dilute hydrogen peroxide and water. And then you want to apply the ointment, and mupirocin ointment, along all your incisions. And that's in that first week. After your stitches are out, you start with a special scar gel that I provide and a skincare routine. And all that's going to really help transition your skin from a post-surgical healing to the normal healing that you're going to have after surgery. Something else to look out for in the first month is sun exposure. And I say this time and time again, but it's okay to be outside, but really put on the necessary protection for yourself. For some people, I'm going to recommend a UV visor. I think it's really important when you go out for walks. Putting on sunscreen, very important. Your scar care is directly related to how much UV exposure you get. And so even after that first 3 to 6 months, if you have a little bit of redness in your scars, you want to continue using sunscreen because that's going to help reduce some of that redness. And that will transition us into some post-surgical laser treatments that we can do to help reduce that redness for you. Something else you should really be doing is taking all your medication. And so after a facelift surgery, the big ones that I tell my patients to take are a Medrol dose pack, which is in the first week. It's kind of a tapered medication that helps reduce your swelling. The second thing is antibiotics, very important. It's an oral antibiotic. The other thing is incision care with the antibiotic ointment and then your scar care. And then for some patients, it's nausea medication if you get nauseous in that first couple of days. For some patients, it's the anxiety medication because you can get a little anxious, and all that relates to getting your heart rate up. So you want to kind of stay relaxed and take this medication once, if not twice a day, realistically. So let's go over this timeline one more time in a high yield fashion. So first 48 hours, it's all about protection and staying safe. Monitoring your blood pressure and getting through those first 2 days is super important. In the first week, days 3 to day 7, the big focus here is your swelling and bruising. This is when it peaks. It's going to get more. At week number 2, you start feeling more functional, but you're still pretty swollen. At week number 3, this is where you start socializing, going back to work, going out for dinner. Fast forward a little bit, now you're in the first 4 weeks to 6 weeks, you're past that 1 month marker, things start to feel a little bit more normal. You're back to your normal routine, you're back in the gym. And then finally, fast forward to months number 3 and month 6, this is where things start to really settle. You feel a lot more normal, and you're actually saying to yourself, I'm really happy I did this. And that's a normal timeline, in my opinion, for a facelift recovery. And this is why understanding recovery before surgery is so important. If you're considering a facelift and want to understand what recovery could look like for your specific face, anatomy, lifestyle, and goals, the next step is a consultation. That's where we're going to talk you through the procedure, the recovery timeline, and what makes sense for you personally. So click the link in the description below to learn more or request a consultation.